This webinar was recorded for the subrecipients of the Tennessee Strong Families Grant on September 11th, 2024. Rachel Pugh, Assistant Director of the Family Advocacy Unit at the Office of Criminal Justice Programs, presented upcoming changes for Strong Families quarterly reporting, annual reporting, and data collection expectations. You can find the slides from this training in our training slides section of the webpage.
The title of this training is the Tennessee Strong Families Reporting. To give everyone a little bit of context as to what spurred on this training is the entire team, the entire family advocacy unit, they've been performing site visits over the last month or so. So at this point, most of you all have been able to meet with the program manager that's assigned to you. They've come out and to kind of see what your day-to-day work looks like and get that perspective. So we've really appreciated you all hosting the program managers and giving them that experience, and then having those conversations, right, to come back and tell us what's needed, what you all need to continue doing the really good work that you're doing, right? So part of what came out of those conversations is a request for some modifications with the quarterly report, which of course the quarterly report is very, very similar to the annual report. So it'll transition over to that to next year. But yeah, so we've made some updates with the quarterly report and we're excited to share those with you. All right, so what we're going to be doing, we'll have a reminder a little bit about the just reporting due dates and the next one that will be coming up. Then I'll actually walk you through the new quarterly report, which it's not a major overhaul, so don't get worried. But there are some updates throughout and a few things added, so I want to make sure you all know what those are, and we can walk through it together. And then also, as I'm doing that, I'll bring about some of the, I guess, challenges that some of you all had over this last quarter, and we'll address those. And then we'll go through just some of the very general definitions, so that way you all know what we mean when we are saying different things. And then we'll talk about some other options for reports. And then at the end, SWARPs, they're on here with us. They'll go over the tracking tool that they've created, and just in case anyone decides now that you would like to use that tool. And then of course we'll have questions at the end, but we also have the program managers that are on here. They're monitoring the chat. So if you have any questions, if you don't feel like speaking up, you can enter your question in the chat and we can try to answer it that way too. All right, so reminder of the report due dates. So the next report that you really have to be concerned about is just the quarterly report. We just got through all of those annual reports, which that included several of them. That happens at the end of the fiscal year. So we have all that behind us now. We're just really concerned about the quarterly reports for the next little bit. So your next quarterly report will be due on October 15th. So that'll cover all of the activities that you did or that you provided from July 1st of 2024 all the way through September 30th. That's the reporting period. So this quarterly report with the new modifications, that'll be emailed out to you all, so you'll have that. And just like last time, you'll complete that, you'll type in the data, and you will email that to your program manager. So it just needs to be emailed to the program manager by October 15th. The dates are super important, guys. The reason for that is we have to go through and vet all of the data, make sure it makes sense. And there are a lot of people that they want to know what that looks like and what the numbers are. And so there are several steps that we do after we receive the reports to kind of gather that and send that out to those people that are interested, which usually looks like leadership, to be honest. All right, and then the other dates on here, just so you know kind of how to plan, I guess, for the rest of the year. If you don't already have this or something similar printed and maybe posted by your desk or saved somewhere where you can reference it, really quickly. I would encourage you to do that. Time passes by really quickly, right? And so this will help you just stay on top of it. And we do try to send out reminders leading up to it. All right, so we'll go ahead and we'll jump right into the actual quarterly report. So this part looks very similar to the last one. I believe the only things that we changed on here is just bolding a couple things. But let's go ahead and look at the notes that I have added just to explain it. That first line here, the total number of individuals served. What we're looking at here we want to know the Tennessee Strong Family clients. Who are the clients? How many of them? And we want to know how many we have for both new and continuing. And so remember that in order to be a Tennessee Strong Families client, they should have a client file. It can be electronic, paper, doesn't matter, but there should be a file on them that contains all the necessary documents according to the grants manual. Apologize, the caffeine is going to kick in soon, I think. But anyways, if someone that you are serving, if you don't have enough information to get a client file, then that means they're really not a Tennessee Strong Families client. So if you report on here that there are 50 50 individuals served, then we would expect that there would be 50 client files that would be living somewhere in your agency and managed by someone. Then the second line here is the total number of new individuals served. So you should have new individuals and you would have continuing individuals. New individuals, everyone is new as of July 1st. So even if you served that client in May of last year, if you served them again on July 1st, they're brand new. Every fiscal year, July 1st, everyone is new again, okay? So what we're trying to do here with the second line is account for how many new people do you have rolling in versus the ones that you're continuing to work with. So this quarter report that you're going to turn in on October 15th, because everyone is new as of July 1st, you're going to have every individual you serve is going to be new. And so it's going to match the total number of individuals served. You're going to have the same number at this top line as you are for the second line, because again, this is the only quarter that really happens because everyone's new as of July 1st. Next quarter, it'll look different. You'll have different numbers in this top box in the second. But this first quarter, those will be the same. All right, and then down here, the third line, want to know the total number of services provided, because you may be working with 50 individuals, you may have 50 clients, but out of the 50 clients, you may have provided 150 services to them. That's more in line with what we would expect. We would actually be asking, several questions if you served 50 individuals and you only reported that you provided 50 services. It's not to say that it's not possible, but we would be checking in with you just to make sure that you understand the differences. These top two boxes it's asking for the number of clients, and then the third box is asking for the number of services, because those can look different. All right, and as far as the totals here, the total number of services provided, what should go here? All the categories below this, it has the breakdown of material and financial assistance, advocacy, emotional support, all those different categories. Whenever you add up all of those services in all of those categories, that's how you should get the number here. Okay. All right. Let's go ahead and move on. So if we work down the report, because can't show it all like at one time, so we're gonna have to break it up. What you will see, the first category is material and financial assistance. Just a little bit of wording has been added here, but the idea is the same. So this first line, again, we want to know how many individuals received material and financial assistance services. That should be new and continuing clients. So yeah, number of clients will go in this category. And then down here, this whole section, we want to know how many services did these individuals that you listed up here, how many services were provided to them? Again, you might have 20 individuals that received material financial assistance, but out of those 20, you may have provided 40 services to them. And that's a real possibility. So a couple of changes are made here. Mainly it's details that are added. So again, not an overhaul, right? So little details have been added here, again, just to try to help you as you're going through this and identifying which category you should select. But car seats was added to this assistance with baby equipment. That's a real common one we're seeing. The food, groceries, hygiene assistance. Hygiene assistance was and groceries that was added to the food, because that's what we're seeing, right? We're seeing that you're going to the grocery store and you're providing those needed items, which usually looks like a combination of a mixture of groceries and maybe some shampoo and other hygiene products, like it's all in one trip. So that made sense to us. All right, and then those are pretty much the same. This is I guess, the biggest change out of this portion. It's this other financial bill assistance. If you compare it to the quarterly report that you all have now, it would have said something along the lines of transportation. This was confusing for a few of the organizations because there was another transportation line under the advocacy part. So what we did, we changed this line here, which originally listed transportation, and we're now calling it other financial and bill assistance. So what this means is that if your program has in your budget, in your scope, that you're assisting with those emergency transportation needs, which might look like assisting with a car payment of some sort, or maybe assisting with getting a vehicle fixed. You would mark that, you would report that service being provided in this other financial bill assistance category. What it does not mean, though, is this other financial bill assistance is not an anything goes. We still have the list of unallowables that we have to go by. What we also do is not only look at what's allowable, but also what does your scope say? What does your budget look like in your contract? If you have any questions, a lot of you are really good about that, reaching out to your program manager and asking if a purchase can be made or if this would fit within the contract. So good job doing that. Please continue doing that. Your program manager does not mind at all to field those questions. We would rather you do that than go ahead and make a purchase and then not be able to get reimbursed later. Because whenever we go and whenever fiscal goes to review the invoices, that's what they're looking at. They're looking at your contract, the budget in your contract, to see if what you've purchased and what you're requesting reimbursement for, does it fit within that contract? And what your program manager is looking at whenever you submit invoices is if you're wanting to purchase something or cover the expense of something, is that in line with your scope and your project? Is that what we thought you were planning to do with this funding? So that's how they base their decisions in approving something like that. Let's see. So yeah, here, those are mainly the changes that have been made. Again, just the little details here, just to remind you that whenever we're asking for the individuals here, we're asking for the new and continuing. Number of clients go here, number of services go down here. Under housing services, nothing changed on this aside from what has changed on all of them, which is just that the little details here. New and continuing individuals who receive those housing services, that's the number that we're wanting here. The number of individuals, number of services. And we've added the instructions here just to help you as you go through it. All right, then under the information and referral, so this I'm hoping will be very helpful to several of you all, and that we've added 2 lines here. Again, we hear you. We've heard your concerns with, you're providing services and you felt like the other report didn't capture everything. So we've added these two lines to hopefully help with that. The first one is that prenatal and medical care. We've listed some examples of what all of that can include. Second is the nutrition information. We do have some contracts that they are covering the salary, or the funding is covering either the salary or a portion of the salary of either a nutritionist or a registered dietitian, something, or maybe a nurse is providing that information whenever they're meeting with the client. So if your organization doesn't have something like that, then this category probably isn't going to be something that you're going to use. And that's good to note for all of these, right? All of these services are not for every organization. So don't feel like you have to come up with something or come up with some type of service that will fit each category. That's not the goal with this. The goal for this is to capture the work that you're doing. It's not to force you to do this work. What you need to go by is going to be your scope. It's going to be your contract. That's what we're expecting from you. So if it's only a couple of services on this quarterly report that really pertain to your project, that's fine. The only time we're going to have an issue with it, right, is if we're looking at your contract, we're looking at your scope, and you said you were going to do all these things, but you're not reporting on it. And it's not because there's not an option to report on it. There might be an option to report on, but you're just not doing that. That's when we would come to you and ask you, hey, you said you were going to do this, you were going to provide this service. There's this option in the quarterly report. Is there a reason why you're not reporting on it? Do you not have a system set up in place to capture that data? Were you not aware that it's on the quarterly report, or that would fit this specific service that you have listed in the contract? So we would have that type of conversation. But just know that please don't feel any pressure to fill all of these boxes. That's not the goal. And then also we've added this little detail to the referral to the OBGYN, pediatric, MD, or other perinatal medical provider. So several of you all are making referrals to doulas and similar positions. So something like that would go in this category. You could report that here. All right, then we have another kind of big change that, again, I'm hoping everyone gets excited about, is the emotional support category. So if you look at the quarterly report that you currently have, you'll notice that the first category under emotional support, I believe it says individual advocacy. Well, what we've done is we've broken up individual advocacy into these two more specific services. So you have the one, oh, sorry, wrong one, not the advocacy. What you'll notice in the current quarterly report is, I believe it says counseling. I think it says counseling instead of regular therapy. So what we've realized, right, is that there are several agencies, all with their different structure and different work that you all are each providing. And so we would really like to make it more clear as far as what each agency is providing and what their work looks like. So to do that, we've made changes here. So individual or group therapy provided by a licensed clinician, this would fit you if your agency is providing licensed professional counselors, licensed social workers, similar positions like that, right, that meet the standards the state has put in place to provide therapy services to clients. So if your agency is providing that through Tennessee Strong Family Funds, then this first line is where you would report that. The second line of other non-therapeutic counseling, those are for organizations that the staff that they have providing services to clients, they may refer to it as counseling. They may refer to it as, those conversations, more of like the deep conversations, they may refer to those as counseling, but you're not providing therapy because the staff position is not, they don't have the credentials to provide therapy. So if that is you, if that is what your organization does, then you're going to want to report those conversations and what you're referring to as counseling in this second box. Okay, so you should only be reporting that you're providing counseling or therapy in the first box if you have those licensed clinicians that are qualified to provide it. Okay. And then the third category, I believe this originally said, either support groups, professional or peer. We changed that a little bit to add what the support groups might look like. So it doesn't matter if they are peer-led or if it's by a staff member, what those look like. If you all are facilitating the support groups, providing that space and that service for support groups, you can report it here in the third category. And that can look like grief support groups, parenting groups, maybe fatherhood groups. It can include more options than that, but we hope that that clears that up a little bit. And in later slides, we've added a few more definitions for individual group therapy, non-therapeutic counseling, and all of that. All right, then we get into education and workforce development. No real changes on here, other than just the added details and instructions. Nothing to worry about there. All right, then we have the advocacy and assistance. This is what I started talking about a couple minutes ago. But if you look at the current quarterly report, you will notice that under advocacy, it has a box for personal advocacy or individual advocacy. We've taken that category and split it into two to, again, just provide more information to those that will look at the data at some point, just to let them know, what do we even mean by individual advocacy? What does that actually look like, right? So it's still general, but it does provide a little bit more detail. So we have the first one, applying advocacy and navigation. That would be something like assisting with applying for services, resource guidance. The way I kind of think about that one, it's going to be more of probably those initial visits that you have with a client, where you're doing maybe the assessment, just the introductions. How can I help you? What's going on? What can we help you with, right? That's what the assessment is. What is a potential need that you have? And then also providing like a resource list of, okay, well, this is your need, all these resources, this is what we have in this area that might be able to help you meet the need. And then the second category is the service and support coordination. How I've thought about this one is it's more of kind of the follow-up, like what is the next step of after you first meet with the client and you assess, what they need, and you kind of give them an overview of maybe the services that your agency is providing and other resources in the community. The service and support coordination is kind of that second step. Okay, well, how can we get those services to you? Does that look like assisting them with setting up an appointment? Does it look like maybe they've tried to set up an appointment and obtain that service on their own and they're just not having any luck? So does that look like you getting on the phone and making that call to try to make that connection happen, right? It can look like a lot of things, but it's normally, or at least how I've thought about it, it's more of that second step. It's more of the follow-up and the follow-through. And then we have the transportation assistance. This is not added. It was on the last one, but kind of the difference with this is it's the only part of the quarterly report now that mentions transportation specifically. And notice it's transportation that your agency either pays for, like maybe they're an Uber or a bus pass, something like that. Or it can also be checked here if you have a staff member working for your agency that's providing the transportation, so driving that client in their car or in the agency car to wherever. This is where you would check it. Now, so it is possible, especially under advocacy and assistance, but really under all of the categories, you can have a situation that, or an interaction with a client where there's more than one service that's provided in that interaction. The goal is not to get as many of these as possible. That's not the goal. The goal is to, how do we record what we're doing with the client, to where we list all the services that we're providing, but without being excessive about it, right? I mean, there's kind of a fine line there. So it's not perfect at all. I get that. We're not asking for perfection on here. Just know that our goal is not for you to check as many of these as possible and to mark a 1 for as many as possible. We just want to do our best to kind of paint the most accurate picture of what you're really doing. So transportation assistance, I mean, that's kind of a big one that has come up. In the last quarterly reporting, every agency provides their transportation a little differently. But with an example for this advocacy and assistance is, you might meet with a client the first day, where you're meeting with them for the first time, discussing with them what's going on. Through that discussion, you're assessing what their needs are and what their situation is, and trying to maybe figure out in your head of how your agency can best serve them. Are there any other resources in the area that can help them? That maybe your agency can collaborate with another agency and pull in those resources. And you're talking with the client about that, right? And maybe giving them the list of what those other resources are. So something like that, I'm going to mark a 1 here for the client advocacy and navigation. And then also in that same conversation, maybe it's a really long one, right? And you're taking the next step again within that same setting of actually setting up the appointment, making that connection from whatever it is they need, whatever service they need, to the actual resource, because maybe it's outside of your agency. Maybe it's within your agency, but it's within a whole other department. And so it's pulling in that other staff member to see if they can kind of jump in and start assisting. And something like that, I would mark a 1 here too. So I have a 1 in this first category, I have a 1 in the second. And maybe through part of the need, right, is going to look like getting that client to the appointment that you already helped call and set up, and you already determined that was a need. So maybe you call an Uber. You're going to mark here because you also provided transportation. That's all one setting. It's all one interaction. It could be a long interaction, maybe not, right? But you can mark a 1 for all of those because you're doing all of those things. What we want, that's okay. What we want you to kind of steer away from is, if you called an Uber, okay, yes, you called an Uber and the Uber has to come and pick up the client and the Uber drives them to the appointment, and maybe it's a whole other time that your agency actually pays the bill for the Uber. So yes, we understand there's multiple steps in that, but what did you ultimately do? You ultimately provided transportation assistance to the client. So instead of maybe marking 4 here for all the little individual steps of actually setting up the Uber, paying for the Uber, driving the client from A to B and that type of thing, I would just go ahead and call it what it is, which it's, you provided transportation assistance, period. So I would say in that scenario, add a 1 here instead of like a 4. So I mean, if you end up having any specific examples, you're always welcome to bring those to your program manager. Like I said, I don't think there's a way to make it where it's perfect, because with each client, you're going to have a different circumstance, different scenario, and same for each agency and how you work and what your normal process is. So keep that in mind. But yeah, we don't want you to overshoot, but we also want you to get credit. Be mindful. All right, have a couple of the general definitions here. Something we're working on and we're excited to get to you is that we're going to have these definitions and more coming your way of each service category. And so aside from just, the small details that are under each service category, like, assist with applying for services, resource guidance, etc., we're hoping to have that and more within those definitions that we're working on. So more to come with that. But at least for right now, right, here are some general ones. Who is a client? Who is a client? A client can be, a Tennessee Strong Families client can be an adult or minor, but they must meet the eligibility criteria for this fund source. Okay, so that is in the solicitation. The reason why it can be a minor is because you may have a teenager that is pregnant. And so that's the client that you're working with. Would we expect for there to be a 5-year-old that's listed as a client? I sure hope not, right? So be very unlikely you would get some questions with that. And Tennessee Strong Families clients, they should, they should, not only should they, but they have to complete the acknowledgement of consent form. That acknowledgement of consent form, it has to be put in their client file. If they don't complete the acknowledgement of consent form and they don't meet the eligibility criteria, then they're not a Tennessee Strong Families client, which means your agency can serve them, but you shouldn't be serving them with Tennessee Strong Families funds, and you shouldn't be reporting them as a client on this quarterly report. New client, again, is the definition of, a Tennessee Strong Families client that's served in quarter 1, or a client that served in quarter 2, 3, or 4 that has not been served yet within the state fiscal year. So every client is brand new. As of July 1st, they're all counted as new, and then they could be counted as new in quarter 2, 3, or 4 if they hadn't already been served in that same fiscal year. And again, the fiscal year, which I put here, is July 1st through June 30th. For any of you all that receive federal grants, there is a different federal fiscal year, so ignore that. We go by the state fiscal year for this funding, which is July 1st through June 30th. All right, continuing client, I provided that here, which, I think I already touched on. And then down here, therapy, group, or individual, just again highlighting that if you're going to mark that you provided services in that category, then you must have a licensed clinician that meets the requirements of the state of Tennessee providing those services in order to mark the service here. So it's all right if you don't have that, but it's a different category that you would put it in. So just note that part, because that is different. So if your agency has been using the current quarterly report form to kind of track the services as you go, which we recommend, it's much easier than like cramming it all in, 2 weeks before the quarterly report due date to get those numbers. So if you're tracking it as you go and you've already been documenting that, you're providing that counseling to your clients, then just ask yourself who is providing that counseling service, and whoever it is that's providing it, do they have the credentials that are required to provide therapy, or do they not? And if they don't, then you're going to move that entire group that you've been keeping up with for this quarter. You're going to move them to, it's the second line, which is going to be the non-therapeutic counseling. Okay. All right. So we know even with these changes and additions to the quarterly report, I'm sure there are still things that you all wish were added to it. Maybe your organization keeps a ton of data that you would like to see reported in this, but it's not. We encourage you to still keep any data that you feel like is important to your agency and important to your project. We're open to looking at that. If you want to send that to your program manager, you can. but we'll keep it on file. We may even be able to do something with it one day, depending on what it is and which origin or like how many organizations submit this additional data, and are they all keeping the same stuff, or is it all individual? We'll see, right? But you are welcome to send that in. We just ask that instead of a 30-page report that your database generates, if you don't limit it to 1 to 2 pages, that would help. So other than that, I mean, that option's still on the table. I think most of the program managers have communicated that to agencies that have asked. Aside from that, subcontracts, you will notice that the quarterly report, it doesn't have a separate section for subcontracts. And that's because within OCJP and all other fund sources, anytime there's been a subcontract, it's lumped in to the other services that the main agency is providing, because it's ultimately your responsibility as a subrecipient to manage any subcontracts that you have and manage that data, manage their work. But it's all under that same umbrella of your organization in OCJP's eyes. So if you have a subcontractor that's providing services, if there is a service on that quarterly report that would make sense for you to report the services that, again, the subcontractor is providing, you would add it to there. You do not have to make a distinction between services that your agency is providing and the subcontractor is providing. But all that to say, the subcontractor, whether there is a service on the quarterly report that fits what they are doing or not, the subcontractor still needs to be collecting data, and they still need to be sending that to you. And where this would come up, if not it being added to this quarterly report, it would come up during the monitorings, because you have to monitor your subcontract if it's a project-based. So if you don't know what I'm talking about there, please reach out to your program manager and we can kind of give you a refresher on that requirement. Or if you're not sure if your subcontract is a project-based versus a fee for service, again, check with your program manager and we can look at your contract and we can get that all cleared up. But whenever it comes time where we come out to monitor, if you have a subcontract, that's going to be something we're going to ask you about. We're going to ask you, how do you know what your subcontractor is doing? Are they submitting reports to you? What do those reports look like? What data are you asking for? Because we're going to want to know, how are you determining, number one, that they're providing services, and two, that what you plan for them to be doing, that they're actually doing, and then three, that it's effective, that it's working, and it's what you had in mind, right? And so we're going to be asking that. So you still need to be keeping up with it, even if it doesn't fit into the quarterly report that we have. But if it does, then you're going to combine those numbers into the quarterly report. And then whenever it comes time to monitor, we're going to ask, how you've kept up with what your agency services are versus your subcontractor services. All right. And then the agency and client success stories. So for you all that had a contract that started before July 1st, you know that one of the annual reports that we required, that was the client outcome report. That's where you tally up all the surveys that you provide to the clients and let us know how those turned out. That's one way that we get outcomes, sorry. But another kind of push that we're going to do is to get more than just survey results. What everyone wants to hear is, what is the impact of this funding? We want to know the impact of the funding on your agency, but we also want to know what the impact of the funding is on the community. If you have a success story, if you have maybe you all provided the survey to a client, and maybe they not only filled out the little bubbles or circled it, but they also wrote a couple statements at the bottom of it. We would love to hear that. We would love to see it. Not just at the end of the year, but as you get them. Because whenever we have people that are asking what's going on with Tennessee Strong Families, how's it going? Yeah, we can give them numbers, right? We can tell them how many clients have been served and how many services, and that's good that there's a place for that, and that's needed. But what they also want to know is, what does that actually mean? Yeah, maybe you served 500 people this month, but what difference did that make? They want to hear that. So anything that you all can do to collect it, I would really encourage you to do that. And the best way to submit something like that is going to be by emailing your program manager, and they send it on through. They'll pass it on up, and we'll collect it. We don't want to share anything that would make the client feel uncomfortable. So if they have, if the quotes or testimonials, if they need to be anonymous, I understand that's not an issue. But yeah, anything that you can do to get that information to us, we would really appreciate it. All right, so before I turn it over to Chase and Brooke with Swarps to go through just the options with the tracker and what that looks like for any of you all that don't know, or if you need a refresher, I want to take any questions that you have. Now, I've not been able to see the chat, but I do see that there's a number above it. So I know there's been some activity there. Are there any questions that have not been answered in the chat that we need to discuss or that you all have?
Rachel, Methodist is asking for some clarity, and I think this would be helpful across the board as well. If you could just kind of revisit and clarify the difference between advocacy and the material and financial assistance, and maybe give some examples. And then also, they provided feedback that it would be helpful if we added those definitions to our definition list for reference.
Well, let me take the last part of that first. So there will be more definitions to come. It'll include literally every section of the quarterly report. It'll include what we mean by that. So I think that'll help a ton. But as far as, let me go back to advocacy. So I mean, let's take client advocacy and navigation to begin with. As I mentioned, I kind of think of that as the assessment piece, where, and maybe through the assessment, you're providing the resource list. You might be telling them what all the agency, like your agency, can help with, but you may not, you can tell them that you can help with all these things, but they might not take you up on it. So if you tell them, hey, we can help you out with groceries, that doesn't mean that you're actually going out and providing the groceries to them. Versus if you actually do go out and buy the groceries for them and get them set up with that, then that's when you're going to mark food, groceries, hygiene assistance. So this is what stuff you actually provided. So you're not just telling them about it. You're not just telling them that there's a resource out there that exists to help with childcare, but you're actually providing it, you're covering the cost for it, whatever that looks like. Katie, I'm not sure if that answers their question, if that helps provide any clarity on it. So like the advocacy part is if you're talking about it, if you're explaining it, if you're providing the options, and then the material and financial assistance is you're covering the bill or providing that item or items to them.
So for example, if particularly within the or within the program, you provide food boxes, for example. If you're providing those food boxes, then you put one under material financial assistance, that can be considered within that quarter. It'll be considered within that quarter as providing those services.
Yeah, like if you provided a food box to a client of yours, you're going to mark one here, because you
Yeah.
provided food and groceries and hygiene assistance. Now, maybe you provided that food box within that meeting with the client where you might have covered a lot of stuff, right? You may have talked about a lot of things. You might have provided a lot of information, and so it wasn't just the food box, but you did the other stuff too. So in that
Okay.
case, you would mark a 1 here because you provided the food box, but you might also provide mark next to the advocacy part, because again, there was
Okay.
a conversation. Now, maybe it's a client that you're working with, and you kind of know after the initial meeting, the initial plan is, you're going to help out, you're going to provide the food box this week, but you already know they're going to come back next week too. And the plan is they're going to come back next week and they're going to pick up a second food box. Great. Well, whenever they come back the second week to pick up that food box, maybe they're literally just pulling up, getting the food box, putting it in their vehicle, and then they're going. They're not having that
Okay.
same conversation where you're doing a check-in and figuring out if there's anything else that's needed, and how's it going in this area. It's not that same type of conversation. If it's a situation like that, that second week, whenever they come back to get the food box, you're going to mark another 1 here. But unless there was more to it, you're probably not going to mark the advocacy part.
Okay. I get what you're saying. So basically, if I was having a conversation where telling the patient, hey, this would be a good source for you, and you're having a complete conversation about the food boxes or whatever else, that would be considered something that you're advising or having that individual advocacy about. So you will be doing 2 in 1. You're providing the food and providing individual advocacy. But if down the line you were just giving the food boxes and she just came on a regular basis, then you would continue to say food box and that's it.
Right. Yeah. I mean, I think probably
Okay.
another example would be I think a couple organizations kind of have it set up where they get a ton of diapers in, and so there's a whole other spot where it's like the diaper pickup spot, and so they may work with a staff member a couple days before the diaper pickup to go through a lot of things, and it's through that discussion the staff worker identifies that there's a need maybe 4 diapers, and so partly in that conversation, whenever they're saying, oh, well, here's what we can help you with, aside from what we can help you with, this other agency also provides this over here. All that's done in that advocacy conversation, maybe a couple of days before. But through that conversation, if it's decided, okay, the client's going to come back in a couple of days to that diaper pickup spot that's a couple blocks over, great. But whenever they do, if there's pulling up, getting the box of diapers, because it might be a completely different staff worker there, and there's just that exchange of an item, then that's going to look different than what that conversation looked a couple days prior. So we want you to get credit for that first conversation, where you make an assessment and you linked them to the service that was provided, but you're not necessarily doing the same thing 2 days later when they're actually picking up the diapers.
Okay. 2 different services.
Yeah.
Okay.
Yeah.
Got you. I also wanted to confirm in the service log, if you are that first service date, if they are a new patient, and you have their first service date, you provide their name and information, what particular service you provided. If they come back again for a different service, would you add their service date again? And would you also add the client ID number again as well?
I think it might help to see kind of how your system is set up to probably give you the best answer. But I can tell you normally in a client file, right, you would have the first date of interaction. That would be listed somewhere on there. And so you would have a list of, well, maybe you provided this service on July 8th, and then they came back again, maybe 2 or 3 weeks later. Maybe it was a different service provided, but you're just gonna have another notation of, maybe it was July 30th that they came back the second time, and then you provided this service. So that way you could see all the times that you met with this client and that you provided a service to them. It's still going to be the same client, though, so you're not going to count the client more than once. You are going to count all the services that you provided to them. And what we're just going to be looking for is within the dates of that quarter that you're reporting on, that's when you're going to go back to the client file and go, okay, well, how many times did I provide a service to this client within this time period? Which
Okay.
what we're looking at is
Okay.
July 1st through September 30th.
Makes sense. Okay. Thank you.
Yeah, no, great questions.
Hey, Rachel. In our chat, we had some questions regarding clarification on individuals that would be considered a client outside of the expectant mother. So maybe some organizations that have like fatherhood services, if you could provide some further information on that.
Yeah, no, I think it's perfectly reasonable, especially if your agency has some type of like fatherhood program or specific fatherhood service. And we're going to expect to see dads listed in there as the clients, and kind of depending on who you ask. Yes, the woman would be physically carrying the pregnancy, would be the one pregnant, but the dad's very much experiencing the pregnancy, and he would be of age where he could sign that Tennessee Strong Families consent or acknowledgement of consent form. So that's a little different than you know, the mom's other child that is maybe 2. Now that child that is 2, you know, they're not going to be old enough to sign an acknowledgement of consent form. So they wouldn't be a client. Now, are they still going to get maybe some the benefit of some of the services that mom gets? Sure. And that's okay, right? Because you are providing services to mom or to dad that helps the family unit that, again, they're all experiencing the pregnancy, they're all affected by it, they're all like in this transition phase of a new member of the family coming in, or maybe it's, you know, the first member and all of a sudden like becoming a family unit, you know, whatever that looks like. So they're all kind of in the midst of a transition. We just don't want to see, you know, if you have a mom and maybe, you know, she has 5 minor kids, we wouldn't want to see that it's the mom and the 5 kids, they're all Tennessee Strong Family clients, because I don't think that would be an accurate depiction of what's really going on. Now, if you help buy food or groceries for a mom and that feeds all the 5 kids, great. You know, that's perfectly fine, but it's still groceries for a mom or groceries for dad or whomever that guardian is, I guess. Actually, I'm not sure if does that answer, or is there more to it than that?
I believe so. But if anybody has any additional questions about that, please feel free to enter that in the chat or unmute yourself and ask. Thank you.
So the question with the dadhood coach is a lot of times they only meet one time with a client. But if they are receiving their monies through TSF funds, each client that they meet with would be counted as a TSF client.
Are you asking if you have a staff member that is over like a fatherhood program and part of their salary?
Correct.
Tennessee Strong Families, then yes, then I would want, especially most of those positions are really high, where it's most of their time is dedicated to Tennessee Strong Families. So what we would expect to see are, you know, the dads that they're seeing through that. Again, there would be dads of, you know, the mom would need to be like pregnant during that time. It doesn't need to be like a dad of like a 2-year-old, because again, that's outside of the scope of the eligibility, right? But yes, the dads that they would see, we would expect there to be a client file on that dad that would say, yep, dad is expecting a child. Dad's, you know, wife, dad's girlfriend, dad's whoever is pregnant with a child. This is when we started the interaction. These are the services we're starting with him. And then maybe a year from now, they're still working with the dad, and that's okay. But yes, we would expect there to be a client file on the dad, even if they never actually see mom. That's okay.
Yes. I'm asking this because it might be helpful for other folks as well. People that are using hotels. I did speak with my program manager, Katie. Shout out to Katie. She's been awesome and answered a lot of my questions. But I just want to ensure that I'm right and remembering that we count just the date that we booked the hotel, even if it's for like a longer period of time, like 2 weeks. And then in the notes section, that's where we like indicate the amount of time. I just want to make sure because I don't want to under-report the work that we're doing. Thank you.
Yeah, no, great question. I mean, and this question actually came up this week with our unit where we just kind of hashed it out, I guess. And what we considered is what some of the other fund sources do, and a lot of the other fund sources they count actual like bed nights. So what they would have you do under other fund sources would be if you put someone up, if you made hotel accommodations for someone for 5 nights, then you could count that would be 5, or it would be 5 nights provided of temporary housing, of hotel housing. And that would be okay. That would be reasonable. Now, we understand that that might not be how you did it last quarter, and that's okay. So we would expect that, if your services can continue, there might be a spike. If you're just counting hotel stay, whether it's a day or a week as one versus now this next quarter actually doing individual days. But we believe that counting individual nights, like bed nights, would be most consistent with other fund sources across the board.
Thank you.
Yeah, good question.
Also, I know that we're going to be receiving the new tracking tool. However, do you have an update of when we will receive that new tracking tool, and will it be under the technical assistance tool contained still?
Yeah, really good question, and that kind of sparked something else. I meant to say if it was not clear. To answer one of your questions about when to expect that new tracking tool, Chase and Brooke can probably give you some more information here in just a second as they get into that. But this new quarterly report that I just went through, with the modifications and changes, that's going to be emailed out to all of you all. What we would like to do is for you to use that report when you turn in your October 15th quarterly report. If any of you all expect to have challenges in doing that and kind of making that transition, and I think that would apply most to those that are keeping up with the data as they go, as opposed to reviewing all of it a week or so before the quarterly report is due. But if you're anticipating some challenges with moving from the quarterly report that you have a copy of right now and this new one with the modifications, please reach out to your program manager and we can work with you on that. But yeah, Brooke and Chase will be able to answer more about the tracker, but the goal is next week, and that should be pretty feasible.
Thank you.
Yeah, the goal is to have it out by the end of next week, at which point it will be available on our website. We will send out a mass email though, and it likely will be attached to that as well, just informing you of us rolling that out. I'd like to add that if you do already have quite a bit of data populated on the current tracker, if you're using it, and you do think you'll have issues transferring that data to the new one, because ideally you'll want to have all the data from quarter one on this new workbook on the new tracker. Please feel free to reach out to us as well. Even if you need to reach out to us before your PM, if it's just about transferring the data. And then if there's further questions about where something might go because of these new categories or subcategories rather, then definitely we'll rope your PM in and get them involved. But just to, since we're already going over that, let me share my screen real quick. Just want to make sure that everybody saw on our webpage now, there is a section under training for the TSF tracker tutorials. If you haven't looked at those, I'd highly advise watching them all. They're rather short, but they're very informative. We also have a tutorial version of the tracker that has the same mock data that these videos have, in case anyone wants that to play around with if they're still not comfortable with it and they are using it to track their data. And once we do have the updated one rolled out, again, the most updated one will always be available right here under technical assistance tools, that TNSF tracking tool right there. Other than that, I think Brooke maybe wanted to go over a few points of where you manually input data on the tracker. So Brooke, if you want to go ahead and steal the screen share from me.
Yeah, sure. I just wanted to bring attention. I feel like most of the questions that we've had with you all when people hop on office hours, just making sure that your data is correct, is the areas that you have to manually input for individuals served. So, those are the things that you'll want to see in your client ID key. Those are the things for service categories here for annual that are going to pre-populate to your annual reporting. And then, of course, also in the quarter sheets, if you slide all the way to the end, those are the service categories. If at any point during the quarter they receive any service that's listed in category A, you'd want to make sure you count that here. That's the main thing that we've seen. People are like, oh, my individual serve count, is really low or whatever. So just making sure that you go back and match it up with that client ID, and then making sure that you are putting in any category served so that populates to your annual report. Also, if you're just beginning to use it, of course, the user guide has plenty of great information. And like Chase said, those videos really do go through, it's very quick, rapid fire, but it goes through just quick instructions and gives you kind of some, like we said, some mock data to actually see it in action. So, yeah. And of course, we're always available every week for office hours. If our office hours times don't work for you, just shoot us an email and we'll set up something individually with you all to make sure that we get you some support.
Yeah. And Brooke, do you have that poll? Do we have that
Yes.
ready?
I wanted to put out a quick poll just to see how many people are using our tracker. Again, of course, some people have way easier ways of doing it, with your electronic health record, and that's totally fine. We support that too, but just so we have an idea of who's using it and maybe who needs support. So yeah.
Yeah, and if you have been using the tracker and already inputting data for Q1, if you want to leave a comment in the chat right now, just stating you've done that, that'll probably be helpful for us to know how many people already have data and are going to possibly need assistance transferring that over to the new tracker. Because we just want to ensure that there's no discrepancy in your numbers, both on, this first quarter, throughout the rest of the year, and definitely how that can impact the annual report.
And make it as easy as possible for you all, because I know it's a lot of data that you've probably already input if you've been keeping up with it along the way. So we want to make it as easy as possible.
We're working on something to help with that as well.
Yeah.
Can I just ask a quick question? Because I guess I was under the impression we had to use your tracking tool. Is it mandatory?
No, it is not mandatory. If you have your own system that collects all the proper data points and it's easy for you to utilize that to do your reporting to the FAU, you're more than welcome to use that. This is just for anybody who didn't have any system of their own that was sufficient for tracking these data points.
Oh, well, that's great to know. And is that the same with the daily timesheets? Tracking the employee's time?
But so if you're referring to the example that was in the orientation training, that's purely an example. I mean, you all can create one that looks just the same as that. Most people though, or most agencies that we see, they have their own version of it. So as far as the activity log, you do need to have an activity log. It needs to account for the hours that a grant funded staff member works, and a little bit of a detail of what that work even looks like that day. But no, I mean it can be in your own format. It just
okay, because I was told that it had to be it was our understanding that it had to be, especially for the employee time work, it was daily reporting, grant time,
yes,
and then time not spent on the grant.
I mean, that's correct, but as far as,
That is,
yeah, as far as what template you have to use and what that visually looks like,
yeah,
that's up to your organization. But yes, there are very specific things that it must.
it must still include all of that.
Correct.
And y'all want all of that. I'm just thinking over 3 years, you want 5,000 records of time records. Yeah,
There has to be an activity log that supports invoicing
right.
for grant funded staff. So I mean, if
Yeah,
that ended up being 5,000, then
that's what you want.
you don't have to submit it to us until or unless you submit an invoice for that time, because that's part of the supporting
Right.
documentation. But
Which is
even
what
with
we,
that, yeah, I mean,
yeah,
even with that, eventually, I mean, there is light at the end of the tunnel after you get so many invoices that you have submitted where there are no questions, it's clear, it's correct. You know, then we'll be able to kind of cut you loose on it. It's just there's a bit of a time period right before we can get there, and some agencies will get there quicker than others. But you would still have to keep that for your records. That should be part of the personnel file for those grant funded staff. That would be like
Where
time sheets and stuff.
where can we find that timesheet, that example of a timesheet? Yeah.
Of the I believe the one she's referring to is the one that's in the orientation PowerPoint. I didn't catch who it was talking, but I can
Bianca, I'm sorry, Bianca.
Okay, great. I can email you a copy of that PowerPoint training, and it's on one of the slides.
Okay.
but
Thank
okay,
you.
all the reporting, the surveys, the time records, the spreadsheets we're talking about now for clients served, all of that though, it's my understanding, and is this correct? All of that information is going to our quarterly reports because that's what we're submitting for reimbursements, right?
No. All right. So what you submit for the quarterly report is going to be this, I don't know, I think it's maybe 2 pages. It's the quarterly report that I've just been viewing here, where you
Oh.
input the numbers. This tracking tool that Chase and Brooke have been talking about, you will not submit that to us. That's just a tool that you all have if you need it. Like if you don't have your own database to capture that data and, you know, tally it all up, that's just the tool that you have to get the numbers that you would then input on this quarterly report document that I've been going through. The other stuff, as far as like an activity log, timesheets, same with like pay stubs, all of that is part of your supporting fiscal documentation that you need to support invoices that you submit for reimbursement. Part of what Tennessee Strong Families funding is requiring, because so many of you all, I mean, except for maybe a few, are brand new to OCJP, and we want to limit question costs, which is a very real thing that we want to avoid, right? Part of what we're requiring for that is whenever you submit an invoice to us, which we would encourage you to do monthly, but no later than quarterly. So that would be a completely different time than your quarterly report that you submit. Whenever you submit an invoice to us, you're going to go ahead and attach any supporting documentation that again supports whatever you're including on that invoice. If you are requesting reimbursement for staff time worked, because that's in your contract budget, then part of that we would expect there to be a pay stub, an activity log, you know, because that's the only way we can figure out the amount that's on your invoice, if that is correct.
Right. Okay. Thank you for that clarification. Because I was thinking it was the activity log was the tracking part of the activity log was the tracking tool, because that's what the client, I mean, that's what our employees are doing. That work.
You still definitely need the activity log, but it serves a different purpose. So it is
Okay.
separate from the quarterly report.
Okay, thanks.
Yeah. Any other questions? I know I've kept you all over. My apologies. We can be talkers. But really good questions, really good discussion. I appreciate you all joining and asking what you did. please reach out to us if you need anything. We don't want to be a stranger to you. We are here to help you. And we're hoping that these are really positive changes and something that will benefit your agency. This whole thing is meant to be positive. It's not meant to make more work for you or make things harder. So if you feel like it is, come to us, talk to us about it, and we'll see if we can get past this first quarter and transition you over to the new quarterly report. So hope you all have a wonderful day, and hopefully we'll be talking to you all soon.